Welcome to In Other Words, the UCLA Tarjan Center's Plain Language podcast, where we interview our speakers from the Distinguished Lecture Series. I am Holly Oliver, the disability rights advocate at the UCLA Tarjan Center, and I will be your host for this episode. For more information, please visit our website, tarjancenter.org. That is spelled Tarjan, center.org. I want to welcome Dr. Patrcia Renno. Dr. Renno is a clinical psychologist at the University of California Can Clinic and assistant clinical professor at UCLA. She works with children and adults with autism. Many have other related mental health challenges like anxiety. She both evaluates and treats these conditions. Before we start, thank you so much, Dr. Renno, for joining us today.
Thank you so much for having me.
As someone who's on the autism spectrum and also has anxiety, I see that many other advocates who have both. This research is very needed. Many people do not know where to get help or how to work on feeling better. We all want to learn more about this important topic. What are anxiety disorders for those of us that need a simpler explanation, and what are the common types of anxiety in autism?
Yeah, great question. And yeah, I'm very excited to be here. Thank you so much. So, anxiety is, a normal emotion that we all experience from time to time. When we think about anxiety disorders, that's when the anxiety becomes much more distressing to the individual. It's very upsetting to them. They're experiencing very high levels of anxiety, more than kind of that maybe more transient anxiety that some people might experience, like at the start of a school year, or maybe before a test, where that kind of anxiety, they experience is pretty typical. Most people experience that, and it goes away quickly. But with anxiety disorders, that's where a person's experiencing a lot of anxiety. It's very upsetting and distressing to them. And oftentimes there's physiological symptoms of it. So they're also getting like headaches and stomach aches, might be sweating, shaking. And then it's also starting to interfere with their life. And so it's making things a lot harder for them to get through their day. And it's keeping them from doing things that they want to be doing. So for some kids or young adults in college, it's preventing them from going to school or attending classes. Maybe it's preventing them from going to a social gathering, a birthday party, or a get-together or a play date. Maybe it's really impacting family and home life because they're spending hours and hours worrying about something. And so that's kind of how we think about kind of what is the difference between just kind of normal anxiety that, everybody experiences, and kind of when it meets that threshold where it's really, really distressing to a person. And then in terms of common types of anxiety in autism, people with autism experience all different types of anxiety. Some common ones that we see a lot are, we do see a lot of social anxiety in individuals on the spectrum. Yeah. Which makes sense, right? Because social situations can, be much more confusing for people on the spectrum. And so that, would likely contribute to higher levels of anxiety, for people where it's harder to kind of know exactly what to say or do. Also, those, social situations, there can also be a lot of sensory input that the person is also dealing with that also makes them really stressful. And so social anxiety is very common. That's where we kind of worry a lot about what other people might be thinking about us, and where we might start to avoid social situations or like avoid participating in class or going places. Other types of anxiety that are common, we also see a lot of generalized anxiety disorder. And this is very, very common, especially in adults with autism, where people are just really much more prone to worrying, and they spend a lot of time worrying. So they might worry about the future. They oftentimes really worry about how well they're doing. They might worry about like their grades in school, or they might worry a lot about like the health of their family members, or about staying safe and things like that. Other common anxiety disorders, and we also see a lot of specific phobias in individuals with autism. And so that might be, people who might be have very specific fears. So maybe like fear of dogs, we see is very common, or like fears of airplanes or fears of bees. And, it's really preventing them from going places because they're afraid of those things. We also do see higher rates of OCD too in autistic children and adults. And that can be challenging to sometimes differentiate between autism symptoms, but we do see higher levels of OCD, and OCD, can really vary depending on the person and what it looks like. But, some of the repetitive hand washing or just really getting kind of some upsetting thoughts in our head and not being able to feel like we can control them, and then doing some rituals around it to kind of try and get rid of those thoughts.
That was a wealth of useful information.
Thank you.
What are behaviors do we see with someone with both autism and anxiety? And what does the research show?
Yeah, really good question. So, common behaviors that we see in people with autism and anxiety is we definitely see those physiological symptoms. And so, the increased heart rate, we see a lot of like gastrointestinal illness, stomach aches, headaches. So definitely those physiological symptoms. We often, common in anxiety is we also see a lot of kind of avoidant symptoms. And so kind of avoiding the situations that we think are scary and that bad things are going to happen, which, makes sense. We want to keep ourselves safe. Um, and then, in autism too, we also see more of those meltdown kind of behaviors where people just get so overwhelmed by their anxiety. And also, like I was talking about before, the sensory behaviors also really contribute to and being, sensitive to things in the environment too. The sensory behaviors and anxiety can really be correlated in autistic individuals. And so, for example, if you're feeling increased anxiety, in a social situation, and in that social situation, you're also feeling like, oh my gosh, there's so many people here. You're feeling crowded. There's lots of bright lights. That can really lead to feeling overwhelmed and, needing to leave that environment, or kind of getting more upset. And then, but also too, a lot of sensory behaviors too, I will say, or sensory comforts, can also help reduce anxiety. Things like weighted blankets can be really helpful for autistic adults. Yeah. And things like, feeling certain textures or smelling certain smells, that are really comforting to people, that can be really relaxing and calming. Going, into a darker room. So that all of those sensory things can be really helpful too.
That was very interesting. What is cognitive behavioral therapy and how can it help?
Cognitive behavioral therapy, or CBT, is a type of behavioral therapy that we know is helpful for treating anxiety conditions. It has been developed, for the last probably, I don't know, over 30 years or something. And it's a type of therapy. It's talk-based. And so a person meets with a therapist. They usually meet, once per week. And it's very focused on teaching a person's skills that are going to be helpful in managing their anxiety. And so it's really based on the idea that what we're thinking impacts our feelings and also impacts our behaviors. And so, or for example, if we're feeling nervous, we're likely to be thinking nervous thoughts, and we're probably likely to, kind of avoid that situation because we want to stay safe. Whereas if we're able to, and then what cognitive behavioral therapy does is if we're feeling nervous about something, but maybe we do some relaxation strategies, we try and calm down a little bit. Maybe instead of thinking all of those worried, anxious thoughts, we think more calm thoughts instead. Then that's going to be related to our behavior too. Maybe we won't be as likely to kind of avoid that situation. And so CBT works on all of those pieces with a person, and really it helps teach coping skills for managing those symptoms of anxiety, helps us kind of think more about calm thoughts, and then also kind of change our behavior with baby steps where we're gradually facing maybe some of our fears, but very, very step by step with baby steps so that we gradually become more and more confident and comfortable.
CBT has helped me, and I hope it can help others.
Oh, I'm glad to hear that.
In your lecture, you discussed modified cognitive behavioral therapy. What is this, and how can this work better for people with autism?
Yeah, thank you for asking that question. Yeah. So CBT has been modified and researched for people with autism, and modified CBT really works to incorporate the strengths of autistic people into therapy. And so a lot of the modifications are related to the strengths that we know that a lot of people with autism have. So, for example, it incorporates things like special interests, and so the person's interests. So that it's more motivating and engaging for the person. Oftentimes, CBT is a lot of times based on kind of using logic. And we know oftentimes, people with autism are very analytical and logical. And then a lot of time people with autism have strengths too um, in using visual aids and seeing things visually instead of it just being, talking. And so modified CBT also uses a lot of visual aids and things like that to illustrate some of the concepts. It also addresses some of the challenges too that a lot of autistic people experience. So for example, for somebody who's socially anxious, we might also work on, some helpful social skills if the person is interested to kind of help with those social interactions as well to kind of help make those go a little bit more smoother if the person's interested in that. Or, it also incorporates a lot of family involvement too. We know, a lot of times that can be really helpful.
This is so true. I believe this will help a lot of people. And I know that things like rewards and like practice and things like that have worked for me, you know.
Good. I'm so glad to hear that. Yeah, we like to have lots of rewards in
Yes.
therapy to make it more fun for sure, and
I,
especially
I,
related to
I
special.
still get rewards. So
Yeah,
it's not like it never
me
gone away from
too.
me.
I love that. Yeah.
What are the three phases of cognitive behavioral therapy treatment?
Yeah. So kind of how I like to break it down is the first phase is psychoeducation. So that's to really, teaching a person and their family about what is anxiety, what are the common patterns of anxiety, how it's based in the brain. And also, one of the modifications too is we like to also talk about autism and what is autism and what does autism mean for that, individual. So a lot of psychoeducation first. Then we teach skills. And so those are coping skills, and depending on the person, that can really vary. But, we teach kind of a person to identify how they're actually feeling, because a lot of times we don't even know we're feeling nervous or anxious. We have to kind of learn what that looks like for our body. And so we'll work on kind of the emotion recognition. We'll also kind of work on identifying what are some of those negative or nervous thoughts we're having, and work on teaching how to develop more calm thoughts, more helpful thoughts in the situation. Sometimes we'll also incorporate things like progressive muscle relaxation or deep breathing that can also sometimes help. And then the last part is the skills practice, where then we gradually kind of start facing some of the feared situations. And we start with baby steps, just like I was saying, so that we gradually become more and more confident in those situations.
You mentioned some successful cognitive behavioral therapy programs and resources. What are these, and how can others find the resources to help?
Yeah, great question. So there are some websites out there that provide useful resources about autism and anxiety. There's also some books and some manuals that have been published for treating anxiety in people with autism and children. There's also, one program that was developed here at UCLA. That's called the BIACA program that has been kind of modified over the years. But that's, a great program. And there's also resources online now for that program with them in the Maya website. And then there's also another program called Facing Your Fears, which was developed by another research group. Um, so yes, I'm happy to link resources and provide those all for you guys so that people have more access to them.
Yeah, I want to attach a copy of the resources in this podcast in the descriptions for those that are listening to have access.
That would be wonderful. Yes, I'm happy to help with that.
Thank you. You taught us that anxiety is very common among autistic children and adults. You also taught us that cognitive behavioral therapy has strong evidence for treating anxiety in individuals with autism, but it needs to be adapted. More research is needed for effective treatments for autistic adults. Thanks again, and I'll see you all next time.
Thank you so much.